The health impacts of the California wildfires will be felt for years to come, marking a major public health crisis alongside the environmental disaster. Wildfires have consumed over 28,000 acres, resulting in at least 5 fatalities and forcing approximately 130,000 residents to evacuate. The largest fire, known as the Palisades fire, has devastated over 17,000 acres in Los Angeles County alone. These alarming statistics highlight the urgency of addressing the health implications of wildfire smoke. Wildfire smoke is a mixture of pollutants, with fine particulate matter, PM 2.5 being particularly hazardous. According to the U.S. Environmental Protection Agency, these tiny particles can penetrate deep into the lungs and even enter the bloodstream, affecting multiple organs. Short-term exposure can lead to mild symptoms like runny noses and sore throats. But for vulnerable populations, such as children, the elderly, pregnant individuals, and those with pre-existing health conditions, the risks are significantly elevated. The immediate effects of wildfire smoke are concerning. However, the long-term health consequences are equally alarming. Research indicates that increased inflammation from smoke exposure can heighten susceptibility to respiratory infections and chronic illnesses. A comprehensive study involving over 1 million Californians found a strong correlation between PM 2.5 exposure and future dementia diagnoses, suggesting that the cognitive effects of wildfire smoke may last long after the fires have been extinguished. Moreover, mental health impacts cannot be overlooked. Many individuals exposed to wildfire smoke report higher rates of post-traumatic stress disorder, PTSD, and depression. The psychological toll of evacuations and loss during such crises can linger long after physical recovery. Disparities in exposure exacerbate existing health inequities. Outdoor workers and low-income communities often face greater risks due to limited resources for protection against smoke exposure. Pregnant individuals may experience adverse effects on fetal development, leading to premature births or low birth weights. As climate change continues to drive an increase in both the frequency and intensity of wildfires in California, understanding these health impacts becomes crucial for public safety. Recommendations for protecting oneself include using air purifiers indoors and wearing masks designed to filter out particulate matter when venturing outside. As California grapples with the ongoing wildfire crisis, it is essential to recognize that the health impacts will extend far beyond immediate physical ailments. Addressing these issues requires a comprehensive approach that includes public awareness, targeted interventions for vulnerable populations, and policies aimed at mitigating future wildfire risks. The time to act is now to safeguard both current and future generations from the lasting effects of these devastating wildfires.